Welcome to the Neuroveda podcast for complex health. We feature expert guests who dive into ancient and cutting edge understandings of health and disease. These conversations are about food, lifestyle, and medicine just as much as about nature, culture, and politics. I'm Jillian Ehrlich, family nurse practitioner, certified in Ayurveda and functional medicine, coming to you from our clinic, Neuroveda Health, in Seattle, Washington. And I am thrilled and excited with our guest today. Not only a brilliant clinician, physician, researcher, but also like a testament to the power of humanity. So let's get right to her bio. Dr. Terry Wahls is an Institute for Functional Medicine certified practitioner and conducts clinical research using functional medicine principles in the setting of multiple sclerosis. In 2018, she was awarded the Institute for Functional Medicine's Linus Pauling Award for her contributions in research, clinical care, and patient advocacy. Dr. Wahls has secondary progressive multiple sclerosis, which confined her to a tilt-recline wheelchair for 4 years, and then she got out of it. So that's the story we're going to be talking about today. She ran away. She biked away 18 miles in 6 months, biked away from it. So Dr. Wahls restored her health using a diet and lifestyle program she designed specifically for her brain and now pedals her bike to work each day. She's the author of the Wahls Protocol, I beat progressive MS using paleo principles and functional medicine. The Wahls Protocol, a radical new way to treat all chronic autoimmune conditions using paleo principles, and the cookbook, The Wahls Protocol, Cooking for Life, the revolutionary modern paleo plan to treat all chronic autoimmune conditions. Learn more about her trials. Those are research trials, not trials and tribulations of the daily life, at Terry Wahls, which is TERRY wahls.com/trials. You can pick up a one-page handout about her diet there. You can follow her on Instagram at Dr. Terry Wahls and on Facebook, Twitter at Terry Wahls. She has a weekly research update that you can sign up for and a newsletter, and I'm so excited to have you for so many reasons. Welcome.
Hey, thanks for having me.
So let's do just like encapsulating in 2 minutes the trials and tribulations of your story, just so for folks who don't have an introduction to you, kind of like, what are we doing here?
So age 45, I developed weakness in my left leg. I see my neurologist who does brain MRIs, spinal cord MRI, spinal tap. It says you have relapsing-remitting MS. I find the best MS center in the country, take the newest drugs. At that time, Copaxone. 3 years later, age 48, I'm in a tilt-recline wheelchair. My physicians had told me about Lauren Cordain. After being a bit low-fat vegetarian for 20 years, I'd gone a paleo diet, but I'm in the wheelchair. I don't know how long it's going to take to have things help, but at least I'm doing something. And that's when I take mitoxantrone, then tizabri, neither help. Then I'm switched to Cellcept. I start reading the basic science, and I decide mitochondrial dysfunction is what's driving disability. I will create a supplement cocktail that helps my fatigue just a little bit. I'm super grateful. Then in the summer of 07, I am told that I'm going to have to start a new job at the VA, working in the traumatic brain injury clinic, and I'll start that in January. My boss describes the new role, and it's clear I physically won't be able to do that, so I'm really quite distraught, but such is life. And then I discovered the Institute for Functional Medicine, and I discovered electrical stimulation of muscles. Shortly thereafter, I get my physical therapist to give me a test session. It hurts like hell, but we add it, and so we add electrical stimulation of muscles to my rehab program. I take the course on neuroprotection. I have a longer list of supplements. And then I have this big aha, and I laugh now how long it took to have this aha. Like, what if I redesign the paleo diet that I've already been doing for 5 years based on this list of supplements? And so it's a few more months of research. I start that new way of eating December 26th. At that point, I cannot sit up. I can take a few steps with 2 walking sticks. My trigeminal neuralgia is relentlessly worse, very difficult to turn off, and I began to have brain fog, which is why my boss reasonably had put me in this new role because he wanted to force me into retirement. So I mean, I think he was right to have done that in retrospect. Yeah. So I start this new way of eating. January comes, watch my new partners for the first 2 weeks from my tilt-recline wheelchair. The third week, I have to start examining patients, but I can do it. And I'm like, oh my God, at the end of the week, I tell Jack, like, I think I can do this. And my physical therapist says, Terry, you're definitely stronger. I'm advancing your exercises.
Wow.
At the end of February, I start walking with walking sticks in the hospital, studying my colleagues. And then in Mother's Day, I tell my family I want to try riding my bike, which I've not done in 6 years. And Jackie tells my 6 6'5", 16-year-old son, Zach, you run alongside the left. And she tells my 13-year-old daughter, Zeb, you run alongside the right, she'll follow. We all get into position, and I bike around the block. And that big 16-year-old boy, he's crying. Zebby's, my 13-year-old daughter, she's crying. Jackie's crying. I'm crying.
And I'm crying now listening. It's just like amazing.
It's amazing. It is extraordinary. So, I bike a little bit more every day after that. And then in October, Jackie comes home and says, honey, I signed us up for the Courage Ride. It's 18.5 miles. However far you go, it's going to be great. And now at
Mhm.
that point, 8 miles was as far as I'd gone. And so I did have to stop a few times, rest, but I made it 18.5 miles. So once again, my kids are crying, Jackie's crying, I'm crying. And that really changes how I think about disease and health. And, it will change the way I practice medicine. And it will also change the research that I do. And I'm sure we'll get into all of that.
It's incredible. So I think it was the first time I heard you speak live at a functional medicine conference, maybe 10 years ago. Yeah, it was about 10 years ago because my mom was at the annual conference with my young son. And I came out of listening to you talk and seeing how you move, you don't have a look of MS, you don't have a look of weakness. And I was telling my mom, God, I just heard this amazing story. And my mom was like, oh, really? Well, how's she doing now? And I turned and you were like 10 feet away, like pulling food off the buffet table. And I was like, that's her. She's just like, she's just rolling. It was at the after party. IFM has great after parties. And so you were just like pulling off food and ready to go dancing. And I just remember my mom was like, "Oh, that is impressive." And so it really is an incredible story and a testament to to so many things, to how important it is to maintain hope, how the answers may not be immediately obvious, but how we have to you have to keep going and keep looking, and to the power of food and diet and electrical stimulation, all the things that you've learned and tried for your health. So it's really incredible. And I'm so glad that you're not just taking this and like living your life quietly, but you're really kind of sharing this with your story and kind of what you've learned.
And when I first started this journey of talking about it, I remember deciding to call the local organic grocery store and say, how about I come give a little talk? And they said, well, we do cooking classes, but we'll do it. So they had to move it 3 times because they had so many people sign up for it. And then the local MS chapter wanted me to speak. And so I said, sure. Then I got interviewed by the clinical advisory committee who thought my message was dangerous. And I got banned as a speaker. And then, the next thing I know, my chief of staff calls me in to say, Terry, people are complaining about you. And I hear you've been banned as a speaker. Like, what the hell's going on? So I chat a little bit. And then he says, you're going to lose your license. You can't be doing what you're doing. So I think it's important that you go to the university's complementary alternative medicine clinic so you can learn how to talk about this in public and in your medical record without losing your license, because anyone can make an anonymous complaint. The board of medicine will inspect your charts and they don't believe in any of this stuff. And if you're making claims, you're going to lose your license. So my little eyeballs went like, that's a problem. So I went off to the complementary alternative medicine clinic and I learned how to very carefully say, this is an alternative to FDA-approved treatments. And I'm supporting cell physiology and then watching what happens, and we'll adjust your medications as needed.
Yeah.
And when I shifted to that message, my partners were fine with it. I never had any complaints. And I'm immensely grateful that John called me in and sat me down and said, okay, you have to learn how to talk about this more appropriately in the medical record and in all these public talks that you're giving.
Yeah. It is. It is very interesting. I mean, as you were first talking, I was like, you and Ignaz Semmelweis. Remember that guy? He in the late 1800s was saying, and early 19 was saying,
Wash your
trying
hands.
to fevers, physicians working on cadavers and then delivering babies without washing their hands. And he died like insane in an insane asylum trying to get this message of the importance of hand washing.
Yeah, he was radical. So how we talk about our journey and what we do have to learn how to do that. And we also have to learn how to do it in a way that does not antagonize our conventional colleagues.
Yeah.
And so I try to make very clear when I'm talking about this is I still want all of my MS patients to keep seeing their neurologist, having the conversations about how a disease-modifying treatment may fit into their care and see their primary care people to keep taking their prescription meds. But if we are successful with improving how your cells do the chemistry of life, and hopefully we will be helping you improve that as we go along, what we have seen in my clinics at the VA is that blood pressures improve, blood sugars improve, moods improve. The doses of prescription meds have to be reduced, and then eliminated, and sometimes just reduced, sometimes completely eliminated. And we have to have a very close working relationship with the whoever's prescribing all these other drugs so that people don't get over medicated. But when I lay out the message that I want you to do both, you have to keep that close relationship with whoever's prescribing your conventional meds, because those doses may well change, and will help you create a better microenvironment for your cells, and then watch and see what happens.
So when we're talking about, my instinct is just to keep talking about our medical system, but I want to talk about, the crux of the work that you're doing. And I love how you're really noting the expansiveness of it. So it's not just MS, it's many other types of autoimmune conditions, and it's also things that we think of as totally separate from autoimmune diseases, which we are now finding out may have some elements of autoimmunity, even things like Parkinson's, Alzheimer's, cardiovascular disease, hypertension, obesity medicine. There's all these.
And many of the eye diseases, glaucoma, the retinal diseases, dry eyes,
Yeah.
all of these diseases have the microenvironment of the cells at the crux of why the disease develops.
And there's so much mitochondrial activity in eyes. And eyes, we think of as the window to the soul, but they're really that window to the nervous system. Like there's so much nervous tissue
It has so much nervous tissue.
in eyeballs. It's like where it reaches the surface, the juiciest.
Correct. And so this is a great way to see how healthy your mitochondria are.
So talk to us about the different elements when you're talking about a cellular environment. What is that like? What's if we're in the playground of the body? Like what are the elements that are in this environment?
Well, I want people to think about the fact if we go back about 1 billion years ago, nanobacteria are happening. They're making lots of oxygen. And as the oxygen content increases, we kill off, I think, 99% of all life forms. I don't know how long it takes, but eventually some ancient bacteria, through random mutations, make the Krebs cycle. Like, so cool. And so then a larger bacteria engulfs the little bacteria, and that's our first mitochondrion. And that leads to multicellular organisms. So we have plants and photosynthesis, and we have animals and movement on the other side. And then the third group is fungi. I don't quite know how they fit in with so I can't quite talk to them. We have to have mitochondria that work really well because they generate the energy that our cells will use to drive the chemical reactions that occur in life. And if your mitochondria are working well, then the tissues can do the job assigned to it. And so when you think of the tissues that have the most energy demands are eyeballs, your retina, your brain, and your heart. And so I tell people that the earliest sign that your mitochondria are struggling are that there's a problem with your vision, a problem with some brain-related symptom, or a cardiac issue. And your eyes and your brain show up usually before the cardiac issues.
Interesting. Just thinking about how my husband and I just had a conversation earlier today where I was like, I think I need stronger glasses. And now I'm trying very hard not to panic.
So how old are you?
I'll be 51 this year in a couple months.
No, that begins to happen. However, I want you to know that I bet you don't do eye exercises. You don't do eye calisthenics.
You know what? I will say that I don't, but I will say, my background in training is in Ayurvedic medicine, and there's a practice called tratak, which is staring at a flame or staring at a ghee lamp. There's a lot of emphasis on eye exercise in Ayurveda, which I still don't do, but
So apparently we can do ocular. So I've just started doing my eye exercises as well. And that the occupational therapy folks that are trained on vision can create visual exercises that will improve our focal length, reduce the need for reading glasses. So we'll see. The eye exercises can also integrate with your inner ear. to improve balance. Because balance declines as we age. Balance is a big issue for people with neurologic disorders, people with MS. So I've gotten much more attuned to wanting to talk to training my patients that we should be doing these eye exercises to strengthen our balance and strengthen the connection between my vestibular system and my visual system.
Fantastic. That's fantastic. Fantastic. And so when we're talking about kind of like, what are the other elements? So in this like playground that we're
Okay. Oh, yeah, that's right. I did not fully answer. I got distracted by
we
the
got, that's okay. We
electronic.
got excited about the eyeballs. There's nothing, I
Yeah.
mean, balls are pretty great.
Right. Eyeballs are very, very great. So in the environment for myself, I'm thinking about toxin exposures. Have I polluted my environment? But we could think about the microplastics that we have created with all of the ways that we encounter plastics, the foods, the canned beverages, those are lined with plastic, the plastic bottles, the nonstick cookware, which is basically plastic cookware, the plastic utensils. So we're exposed to a huge amount of plastics, and we're beginning to be aware that those plastics are getting into our blood, into our brain, into our blood vessels. And so those plastics are a problem. Then uh, we've used chemicals to improve the efficiency of agriculture, construction, food processing. And so we have so many chemicals that we're exposed to in our water, in our air, in the food that further compromise our biological processes. And then the next thing we can talk about is nutrition. The quality of our diet and nutrition has steadily plummeted. It's ultra processed foods, added sugars, white flour, foods. As we process foods so they can have a longer shelf life, that processing removes minerals, removes vitamins, removes antioxidants, removes essential fats, adds dyes, adds emulsifiers, adds stabilizers, adds food-like chemicals that make the food hyperpalatable to overwhelm the natural satiety mechanisms to encourage you to overconsume. So the food's less nutritious and your physiology is being tricked to overconsume.
Yeah.
So it makes me more likely to be starving for the nutrients my body needs, my cells need to run the chemistry of life. Our children get 70% of their calories from these ultra processed foods. Adults, we get 60% of our calories from ultra processed foods.
Did you see that article that just came out on Takis?
On what now?
Takis? Do you know Takis? It's a chip kind of like a Dorito, but it's got some crazy, I don't know actually what it is in it, but I've had a number of patients a number of pediatric patients who've had real trouble with Takis. And then there was an article that just came out. They're calling it Takiitis, where kids are getting chest pain and some other severe symptoms. And the patients that I've seen have had kind of like ADHD, autism-like flares, sensory
Well,
symptoms.
I worry people will see paleo-friendly or keto-friendly ultra-processed foods.
Yeah, yeah.
I see these veggie chips that are healthier for us, but I'm like, eat the vegetable. That would be healthy. So
let's talk about your program, which is so fascinating between the 3 cups of the 3 groups.
Oh yeah, so when I had my own personal recovery, I had these long lists of nutrients I knew I needed. Figured out where they were in the food supply. It's a list of food ingredients that I was stressing, and then I changed how I practiced medicine. So I wanted to be able to teach my veterans how to do this. I couldn't just give them these food lists. So then I had to think of like, okay, I need a message that I could deliver in just a few minutes that would be easily understood and memorable and would get them eating the stuff I wanted them to eat. And that's how, excuse me, the 3 cups of green leafy vegetables, 3 cups of deeply colored vegetables and berries, and 3 cups of sulfur-rich were born. And my vets would say like, so doc, is that per week or month? And they'd laugh, and I'd laugh. So, no, that's per day. And of course, my veterans are mostly men. If it's a petite woman, it's going to be, clearly much less. And then, so you don't need to consume beyond what your appetite would allow you if you're a very petite individual and exercising a whole lot. Maybe it's 4 to 6 cups. But that way, you're getting the elements that we've said that you need. And there were 18 different nutrients that we were tracking to be sure that these food rules would get you.
And so let's talk about, like, for each of those groups, like, for the leafy greens, does it matter if they're raw or cooked?
So now here the ideal is you're going to have a third cooked, a third raw, a third fermented. I personalize this because I ask, are you pooping rocks, logs, pudding, or tea? Or make it even simply. Is the poop coming easily, or is it coming too easily and it's in your pants, or is it a struggle to get it out? So if you're constipated, you need more raw and more fermented. If it's getting out when it shouldn't, you need less fiber. So uh, cut out the raw. You might have to reduce the fermented, and you need more soups and stews.
Great, great. And so what are the nutrients that you're pulling out of each of those categories?
So in the green leafy vegetables, you're going to get a lot of calcium and magnesium. You'll also get a lot of carotenoids. Carotenoids, vital for your retina, vital for your cornea, vital for your lens, and vital for your brain cells. Remember, your eyeballs is an extension of your brain. So all those carotenoids protect your retina from the UV light. Remember, we need UV light so we can make vitamin D, but the UV light damages your retina. And you want to be able to see, so all those green leafy vegetables protect your retina from the UV light. And also the green leafy vegetables, a great source of vitamin K1 that with the right bacteria in your bowels, they will metabolize it to the bacteria form K2, MK7, which you'll absorb from your bowels into your bloodstream and your ileum, which will take it to your liver. The liver will metabolize it to the animal form K2, MK4, which, by the way, the highest concentration is in your brain. And in the animal models is linked to better remyelination.
Wow.
So
Great.
a lot of reasons to have those green leafy vegetables.
Great.
Now, for the cabbage family, so that's the brassica, the onion family, that's the alliums. Those really boost our detox enzymes. They help lower the innate immune system. And so it's a really very nice rebalancing of the cytokine profile. Mushrooms, again, you have to be careful that you have identified the mushrooms, that they're culinary mushrooms, they're medicinal mushrooms. You just can't go out into the wild and eat any old mushroom because there are mushrooms that are poisonous.
Yeah.
And likewise, there are plants that are poisonous out in the wild. So if you're going to forage, and I do like foraging, I think I've been a forager. I love foraging. It's lots of fun, but you have to be very careful as a forager to properly identify the plants or the fungi so you don't get yourself into trouble. Having said that, we do know that from epidemiologic studies, the more mushrooms that you eat, the lower the incidence of anxiety, depression, cognitive decline.
Interesting. For any kind of mushroom? I mean, any kind of
edible mushrooms. That has to be edible. The
But when they're
non-edible ones will kill you.
Yes, or like, but regardless if it's like shiitake or button
Right.
white.
So from the epidemiology, good for anxiety, depression, cognitive decline. And there are a number of studies that have shown the shiitake, miyatake, lion's mane. There's another mushroom. I'm not recalling the fourth mushroom that have been shown to boost nerve growth factors.
Amazing.
So lots of reasons to include mushrooms. And you could also use nutritional yeast, which is a great source of beta-glucans, a good source of B vitamins, good source of selenium and other minerals. So I personally, and I made some today because today I took my savory, minced it all up, and added that to some ground bison and made stuffed grape leaves. And then I made a dipping sauce with savory olive oil, lemon juice, and added a whole bunch of nutritional yeast. And so we'll use that as a dipping sauce as well.
Thick. So tasty.
Okay, so, and then we have a deeply pigmented. So the pigments known as carotenoids, these are big molecules with multiple rings in the molecule. Those are called polyphenols. So each ring is a phenol. Polyphenol, multiple rings, too big for us to readily absorb them into our bloodstream when we eat them. Scientists used to think like, okay, that it's really not a very important food item. Well, now that we've been doing metabolite analyses, we realize that the bacteria in our bowels take those polyphenols and they digest them and they digest each other's byproducts. And then we absorb those bacterial metabolites. And those bacterial metabolites do a marvelous job of calming the innate immune system. So again, you can look at your food. The pigments are a nice way of categorizing food as being rich in these polyphenols that your bacteria are going to love, that will help you calm your innate immune system.
And the innate immune system for listeners at home is
Okay.
mast cell activation syndrome if it's abnormal.
Yeah, so when you are first exposed to a new virus, let's say I come to your home, Jillian, and there's a new virus that my
What are you saying about my home?
yeah. Well, diverse. You have diverse different germs than I would have.
That's sweet. Iowa is very far from Seattle, and we have
Okay.
a lot that goes on.
So we have a different virus, or perhaps I picked up the virus on the flight there. So a new virus that I've never been exposed to. My innate immune system is recognizing that this is a likely pathogen, and they will have sort of a non-specific immune protection. So they're in charge of protecting me for the first 2 weeks. While my adaptive immune system is figuring out how to make antibodies. The innate immune system is the first line of defense. The adaptive immune system, the antibodies, is the second line of defense, assuming you lived 2 weeks and you are still alive when the antibodies can come online. And so we all want to have a strong innate immune system so we can live the 2 weeks waiting for the antibodies to come online. But you don't want the innate immune system hyped up all of the time. You want it hyped up for the acute threat, and then to calm back down when the the antibodies are ready to take over. The innate immune system should be able to calm back down and be quiet.
So I love your 3 cups, 3 cups, 3 cups, or how, those proportions. We've talked about some of the nutrients in each of them. I'm curious how your program has evolved over the years and kind of what
Well,
kind of evolutions are happening.
So the 3 cups is here. Those are things to add, the things to remove. I talk about the two most common unrecognized food sensitivities are gluten and casein. Gluten is the protein in wheat, rye, barley, many ancient grains. Casein is a protein in dairy, and they are structurally they have a similar amino acid sequence. So are bothered by gluten, you'll probably also be bothered by casein. The third most common problem is eggs, the protein in eggs, and I'm quite sensitive to that as well. So I ask people to take out gluten and dairy and to consider taking out eggs at least temporarily. And then after a month or two, you can try reintroducing eggs and see if you tolerate the eggs. And you can do that basic plan either as a vegetarian or as a meat eater. My preference is that people eat meat because it's a complete protein, but I realize for a variety of reasons, people may prefer to be a vegetarian for their ethical reasons or for the financial limitations, because it's cheaper to have beans and rice than it is to have meat. And then we can get a little bit more sophisticated, talk about fermented foods, talk about seaweed, talk about organ meats and why that's helpful. And then I also talk about circumstances where a ketogenic diet may be very helpful for people with more advanced neurologic, psychiatric disease, the people with cancer do very well with a ketogenic diet.
And so if we go back to those questions about cellular environment, what shifts with a ketogenic diet?
If you will go back to our mitochondrial friends, our mitochondria, the easiest fuel for them to burn is glucose. In our cytosol, the rest of the cell outside of the mitochondria can also burn glucose. The mitochondria can burn amino acids, and it can also burn ketone bodies or fat. And if you are on a ketogenic diet, you reduce the carbs and it depends if it's a medium chain triglyceride, so a lot of coconut oil, coconut milk, you make more ketone bodies than if you're not on a medium chain triglycerides. In that circumstance, you can get by with about 50 grams of carbs. If you're doing a dairy-based ketogenic or an olive oil-based ketogenic diet, then you're 35 grams of carbs or less. So that's like a big plate of salad greens and maybe a couple stalks of raw asparagus. So not many carbs at all. And you're going to have meat, fish, and probably 4 to 6 tablespoons of fat. I like to stress olive oil. There are other physicians that stress butter and dairy. I don't like and a lot of eggs. I don't like doing that because I think dairy and eggs have the potential to be inflammatory. But by burning ketones, it shifts in the brain. Because we know that some people get the brain's not doing a very effective job of burning glucose. And that leads to more anxiety, more depression, more seizures. And if we shift the brain to burning the ketones, the anxiety goes down, depression goes down, seizures are resolved. It's been effective, very helpful for people with psychoses. And because cancer cells can only burn glucose, they can't burn ketones. If you do a ketogenic diet and you sort of time that with your cancer treatments, you get greater cancer killing and fewer side effects from the cancer chemotherapy. So there are more oncologists that are now including a ketogenic diet as part of their cancer treatment.
Really amazing. Do you know why burning glucose does that?
Well, we don't know why some people's brains become less and less effective at burning glucose. But we do see that in people with anxiety, severe depression, worsening cognitive decline, often do much better if we either give them ketone salts or put them on a ketogenic diet so that they have ketones to burn and are not reliant on the glucose.
If you take a person with like kind of a standard healthy diet, not somebody who's on Twinkies all day long, but somebody with this kind of
Yes.
regular healthy diet, and you add ketones, does the brain actually pick them up as opposed to kind of that typically preferential glucose?
It will take the glucose, but if the person has no neurologic symptoms, no psychiatric symptoms, they'll just take the glucose. If they have some level of psychiatric or neurologic symptoms, they will probably start picking up those ketones. So it really depends on, is there some level of brain dysfunction present that suggests the brain is not utilizing glucose as efficiently.
Great. Okay. So interesting. So your research, tell us a little bit about kind of research findings, how they
So what are some of the interesting things that we're seeing? Okay, so we did a study comparing a low-fat swank diet, which we actually improved. We had people eat more vegetables, more whole grains, and the modified paleo. We call that the level 2 Wahls diet. And we saw that compared to the observation period when people were eating their usual diet, that improving diet quality led to reduced fatigue, improved quality of life. The Wahls group was better than the Swank group for many, but not all of the measures. Then we measured something called the MS functional composite, which combines walking function, 25-foot walk test, hand function, 9-hole pegboard, and working memory, symbol digit modalities test. And what we saw was that compared to the observation period, improving the diet led to improved measured clinical disability. Phenomenal, because we told people to not add an exercise program during this 6-month study period, and they did not. So just improving their diet led to improved measured disability. Then we went back and looked at a couple of studies that we'd done, randomized controlled studies of a paleo diet in relapsing-remitting, and another one that was done with progressive MS. And again, we showed the same thing, that improving the diet led to reduced measured disability. So super exciting. We have another study that looked at, it's a quasi-experimental study. This is a non-inferiority study where you're comparing two interventions. People could choose which arm they're going to be in. So a newly diagnosed MS patient who was told to take a DMT, they could say, yep, I'll take the DMT and I'll eat what I want and do whatever I want with physical activity. So that's the control arm. The intervention arm was
being disease modifying
treatment. Yes, thank you. And then the intervention arm was I decline the DMT, but I'll get trained on the modified paleo diet. I'll get trained on a 4-7-8 breathing practice, and I will start doing a brisk walking program. Now, where we're going to see people in person and get MRIs and do clinical outcomes, but it started in 2020. Fortunately, It started at the beginning of 2020, so we had to quickly redesign a virtual only study. And so we made do with the hospital anxiety depression scale, a couple of fatigue severity scales, and patient determined disease steps, which is a cognitive scale. We're able to show that the health behaviors was not worse than the disease modifying treatment arm. Remarkable. And we measured the relapses, again, based on verification that the patient was given salbutamol for a relapse. During that time, we got medical records to confirm that there were really 4 relapses in the 29 folks with the health behaviors arm, 2 relapses in the 15 folks with the control arm, so equivalent. Now, unfortunately, I wasn't able to make any statements about the fact that they were equivalent in the paper, other than to note that they had equivalent relapses in the 2 groups. Now, for people who don't want to take DMTs because they're trying to get pregnant, they're breastfeeding, or when they read the rare but serious potential adverse effects from the disease modifying treatments, this findings would suggest that a modifiable lifestyle factors does not worse than standard care for controlling symptoms and may appears not to be significantly worse for relapse risk. So it's a fancy way of saying I think everyone should be doing the environment and modifiable lifestyle factors, and you can decide in a close conversation with your treating specialist, do you take how the taking a disease modifying treatment fits into your care?
Absolutely. Absolutely. We always have to customize care for the person and their capacity and their interest and their desire and their belief system.
And I remind people that it's a very personal decision. Are you more afraid of future disability or future adverse effects of the drugs? Now, I took very potent drugs when I was actually quite seriously disabled because my hands still worked and I could still feed myself, I could still talk. And so I took drugs that had a 2% chance of giving me acute leukemia each time I took them. That's a big thing to read. And I don't remember what the risk was for heart failure, but that was also another big risk for the drugs I was taking as well. But I didn't want to become even more disabled, so I was like, yep, I was fine with taking those highly potent drugs. So it really depends on your level of disability right now, and probably your disease burden, how many lesions you have, where they're located, and how severe the impairment is, what makes the most sense.
Yeah, and I think the capacity too, so some people are, I've worked with patients moving from fast food every single meal to, those who come to me like I'm on the perfect diet. And so we're always trying to move the needle down the same street. And everybody starts at a different spot in terms of their movement, their capacity.
Some people are ready when they come see me. They're like, okay, I'm ready for a great big comprehensive plan. Give me all the details, everything that I could be doing. And some are like, I got to negotiate with the whole family. We have to put a plan that the spouse and children could live with. And so we're making step by step changes. And I do encourage people to make changes as a family, because if you view this as a family intervention and you agree what you're going to remove from the household, what you're going to add to the household, you'll be far more successful. If you're just going to say, I'm the one making this change individually, and I'm going to watch my family continue eating everything that they used to eat that I really love, and I'm not going to eat it anymore. I'm going to salivate. What will likely happen is you can do that for a time, but you will likely eventually go back to the previous eating what your family's eating. So if that means that you can't do the paleo diet, but you could do the Mediterranean diet, because the family could do the Mediterranean diet, I'll say, do the Mediterranean diet. Let's do that for a while, and then come back and we'll talk about when you're ready to take the next step.
Great. I mean, as you're talking about family, I'm just like picturing, you and your 2 kids riding on each side of you. I really do. I think that we are happiest if we succeed or if we struggle together.
Correct. And I remind when we're doing things as a family intervention, what we want to do is agree what's going to be served at the table that I'm eating at. Now, when you guys go away and you could tell me that you're going to have pizza and beer tonight, and so Terry, would you please go out with your friends because we're going to have food that we know you can't eat. And like, okay,
Okay.
that's great solution. Or that everyone else in the family is going to go out and have foods that they know I can't eat. So it's not that you have to eat the way the patient is eating all of the time, just in the presence of the patient, agree what's the plan going to be and acknowledge that away from the patient, of course you eat what you'd like to be eating.
Yeah. Yeah. And I remember you talking about when we were in San Diego together having lunch a couple weeks ago that like the way that you practice has really come around full circle. That you started out kind of
Oh yeah, I was very rigid. I wanted people to do it 100% all the time, be very complete. And I realized that I was creating some orthorexia. People were like, they were very, very rigid. So now I screen people for, do you have a compulsive traits? How fixated are you? And I do not recommend an elimination diet to those folks. I may put that person on a Mediterranean diet very intentionally first. So my paleo friend, Lauren Cordain, he said, do the paleo diet 80% of the time. You can do very well. And then you could gradually increase that at a tempo that you want. And I think that's okay too. What I do try to teach people is pay attention to when you have a flare of symptoms. In the previous 24, 72 hours, what were the exposures that you think might be linked to that flare? And the more you can pay attention to that, you may figure out what foods are your triggers, and then you avoid those. Or we can do food sensitivity testing and then understand that a little more precisely for you.
Yeah, absolutely. And it's also come back around kind of how the societies and medical organizations have welcomed your work. Is that right?
When I first started going to some of the MS research meetings, I was the only one talking about food, like real food being
Yeah.
important. I've been going 8 years to these meetings. Now, when I go there, people are whipping out their phones, asking to get a photo with me. The clinicians are wanting to get photos with me for their patients. And even the PhDs are wanting to get photos with me. And I see my work being quoted. I see my books even showing up in these presentations. So, I fully expect, in the next 5 years, certainly within 10 years, it will be the standard of care that people will be being told that diet really matters, that yes, Mediterranean diet is good, paleo diet is good, ketogenic diet's another option, low-fat diet's an option, intermittent fasting is another option, calorie restriction, pretty tough. That one's never going to really cut it because it can't make people be hungry the rest of their lives.
Yeah. Now we hear my dog. Great. Great. Well, I love the conversation that we've had today. I loved thinking about our nervous system as kind of one of the most active places for our mitochondria and where they've come from evolutionarily speaking and how our brain uses energy and how our food can be so elemental in producing that energy and the type of energy produced and how it gets used. So awesome conversation. Any last thoughts before we close?
Well, one more. I want to give another pitch for everyone to please follow me on Instagram. You get to see me talking about what I'm eating, what I'm doing, my garden. It is so much fun. I hope your followers will come join me there.
Well, yeah. Well, and I just have to, your wife is also such a doll. And so
Yes,
there's a
she's the
lot of
videographer, so follow me on at Dr. Terry Wahls.
Dr. Terry Wahls, and then there's Jackie saying, "This is Jackie, and here's Terry and what you're eating." And I really appreciate it because you are clearly like Iowa born and bred. This is not, you are heart of America, at your table, which is not like, a gilded table. This is, you're at a normal kitchen table in a normal outfit, eating a normal plate of food that
Normal
is,
food, and it's not hard to make. I stress that when I wrote my cookbook that I wrote it for people who are going to have to shop in small town Iowa. In
yeah. But
small
wait,
town
okay. But then you talk about eating like organ livers. Where do you get those?
organ livers? Well,
Like
we have them.
organ meats,
Yeah,
liver.
right. You get liver. Liver is in the grocery store here in Iowa, so people
Okay.
do eat liver. Yes, chicken livers are very easy to get. I also get lamb liver, and I get animals from the farmers directly. And because they know that I'm happy to have the extra organ meats, so I get extra liver and heart and kidneys because a lot of their other clienteles don't realize, like, man, like those are so good for you. So
Yeah.
we end up with,
For nutrients.
yeah, we get that. And tongue. Tongue is spectacularly good.
I have a whole yeah. I mean, as a Jewish person, I have, like, my whole family is like, "Oh, tongue." There's
Tongue is good.
yes. Yep. Yep. Perfect. Okay. Well, anything else? Anything else we should mention?
Well, if you have anyone with a chronic neurologic mental health autoimmune problem, please send them to terrywalls.com/trials so you can sign up for a patient registry because we will have a number of trials that you'd be eligible for and would love to get you enrolled.
So Terry Wahls is Terrywahls.com, and you can do /trials to be part of the clinical registry. You can do /email to sign up for the newsletter and get the, the information. And then you're on Instagram at Dr. Terry Wahls and on Facebook and Twitter at Terry Wahls. So these are all the ways, and then obviously your books. So easy to find your books everywhere, sold everywhere. But both the books about your story as well as your cookbooks. It's just you're doing incredible work, and it's so fun to be a part of it, and it's so fun to have watched you these last 10 years along your path. And thank you for being with us here today. And we love that you've joined us today to discuss how to make our whole world medicine. We rise or fall together and are committed to sharing knowledge and insight that empower us and our communities towards greater health. Thank you for listening to the Nervata podcast for complex health, and we'll see you next time.